Well, often when we have a guest on from Breastlink, it is usually one of their doctors or staff. Well, today, what's really nice here, we have one of their patients and also a very best friend of the patient as well. I'd like to introduce Kapri Griffin. Nice to meet you.
Good morning.
And SueAnne, did I pronounce that right?
Yes.
Good to meet both of you.
Thank you.
And first I want to say that Kapri is the person that went through procedures at Breastlink, and your good friend was there. Tell me about your experience with your diagnosis and at Breastlink. How long ago did this happen?
Well, it's been, I guess, almost 2 years since diagnosis now.
Okay.
I went to an outside, not associated with Breastlink, imaging center and had a biopsy. Got a phone call back and thought it would just be routine, nothing, and was diagnosed kind of over the telephone briefly, quickly, and immediately made some appointments for consultations, one of which was with Breastlink.
Okay, and at the time, did you use the one here? I know they have a facility in Orange, I think in
They were in the
Temecula.
middle of their merger when I met up with them. So,
Yeah.
but I did finish my treatment here in Laguna Hills.
Okay, because I know that was right about the time that they started to come over here. Had to be quite scary at the time.
Yeah, I mean, I think being diagnosed with breast cancer is shocking for anyone. Definitely shocking for me. I was young, no family history, so it really stopped me in my tracks.
Yeah, I bet. You're fortunate. You have a very good friend here with SueAnne. And are you? Do you have family members as far as close by here? Are you married or?
I do. I'm really blessed. I have a husband. I have an extended family, and I have a great circle of friends. So.
And that's important during this
huge.
time, isn't it?
It's huge.
SueAnne, your best friend gets diagnosed with cancer. At times, I have heard that the shock is almost more so for the friends and family than it is for the person, because the person was just like setting it back for a moment and digesting it, where the family members and friends are the first ones sometimes that really show a lot of concern, outward concern.
We were shocked. I was with Kapri right after she felt the lump before the biopsy. And I was shocked to find out that it was not only stage 4, but triple negative.
Wow.
And what we did immediately, like she said, I'm one of many caregivers that Kapri has. And immediately when we found out, I remember I was at work and I conferenced in 2 of our other friends, so there were 4 of us on the phone. And we all spoke about it and made a plan, and got together on a family meeting with extended family, Kapri's family, and we allowed Kapri to set up what she needed and wanted. Sometimes when people are diagnosed, not sometimes, all the time, there's a lot of choices that are taken away from the patient because their life changes completely.
Right.
So I think it's really important to listen to the patient and let her tell us what she needs and wants.
Was that difficult for you? Were you outward with it, or did you kind of
really
just become
open.
very centered?
No, I was really
Okay.
open with it because I think I knew I was going to need a lot of support, and it's not something I'm good at asking for. So by putting it out there that, hey, this is happening, it allowed people who were willing to come to me and say, we want to help. What can we do? Because asking for help is not my strong suit like a lot of people. So.
Yeah, I think over the years we've heard people who go through things like this and in other medical events, and a lot of times their position is, I'm okay, I don't want to be a burden to anyone, I'll ask if I need it.
I definitely think that doing what's counterintuitive to you is the most important thing during something like this. It allowed for richer relationships in my life with people that were already there. And if I had closed off, I think it would have been a much worse experience for me and for them.
So from the time that you were diagnosed to all the different procedures you went through, about how long was that?
I started treatment October and was finished with radiation in time for Thanksgiving, so a total of a year.
Okay.
But my treatment plan was pretty extensive. I have what they lovingly referred to as the works. So if there is a treatment, I got that treatment.
Okay, so you got everything that
I had
you needed.
neoadjuvant chemotherapy, which is prior to surgery to arrest and shrink the tumor. And then I had partial mastectomy with reconstruction all in one surgery, which is new and amazing.
Right.
And then I had radiation treatment for 6 weeks.
Wow. What was your energy level during that time? I imagine it was pretty low, and how did you and your other support group come into play?
Well, like SueAnne said, we had a meeting and kind of put together what will I need help with, what will I be able to do based on what the doctors at Breastlink really helped me understand what's going to be happening to me. And we built an online website really where people could pick a chore, take it and do it.
Okay.
And that was really helpful instead of all the phone calls of what can I do? Oh, nothing. It was sort of like I need meals for this week with my family, and people handled it.
Yeah, I've seen those websites for other things.
It's amazing. Care.com, I think it was called.
Yeah.
No, not Care.
Yeah, I've used it not for us, my family personally, but others we knew, and to help them out. I know you're married. Do you have kids?
I do.
Okay, how was that?
Well,
how did you communicate with them? What are their ages?
I have now, at the time of diagnosis, I had a 25-year-old and a 5-year-old.
You have a 25-year-old?
I do.
All right, the 5-year-old I could see. The 25-year-old I never would have
That's
guessed.
for another show.
Okay. You just don't look that old to have a 25-year-old.
Thank you. Yeah, one of the really defining factors of why I chose Breastlink was Dr. Curcio's humanity in dealing with me at initial diagnosis. And one of the questions I asked all of the doctors I went to see was, how do I tell my 5-year-old? That was really heavy on my mind. And most of them brushed it off and hand me a pamphlet on cancer. You know, she didn't. She took the time to really say, that's a tough question. Hand me a book for children. Help me navigate those waters. And I was just brutally honest. I mean, I didn't say what the end result could be, but I said, Mommy's not going to feel well. Mommy's going to lose her hair. Mommy's going to have surgery. All those, I was just honest. And it helped her, I think, really adjust to the changes as they happen.
Yeah. Did you ever have a time that you interacted with her kids as well to kind of tell them what's going on?
Kennedy is, sorry, I'm going to get emotional.
Kennedy is with
My daughter,
Kennedy is
the
a 5-year-old. And I was with Kennedy since she found out she was pregnant. So we are so blessed to have this extended family. I'm auntie, and she knows she can come to me. And my daughters know her daughter, who my daughters are 27 and 25. So it's this big extended family that wherever we were needed, we stepped in.
Yeah. How long have you been friends?
Oh, I don't know, maybe almost 15 years.
Okay, so
Yeah.
quite a long
Yeah.
time.
Yeah.
Yeah, I can see where that support, especially there were times when you could maybe talk to the kids in a different, approach it a little bit differently. That would have been a really big help, and just all the other care and support that you gave. One of the things that this is something that you did that was fun, that Breastlink does. I forget when they did this, about 2 or 3 months ago, the Breast Cancer Thrivers Cruise. And
Yeah.
you both went on that. Did you go on this year's or previous years?
This year, this most recent one. And it really was a great experience. I didn't know what to expect. I had never been involved with anything like that before, and it was a really rich experience. I mean, it gave me some downtime after all of the big part was over, and a lot of chance to relate with people who had been through what I've been through, and get a new appreciation for the support I did have, because a lot of people don't have that kind of support.
Yeah, I think that's great that you're able to have that. But I know that one of the things that Breastlink is very good at, maybe people don't have as much support as you did. They have that support there as well.
Absolutely.
They obviously do everything else that is needed, the medical part. But I know, in fact, I think we've had them on the show here before. They have people that are just there for that purpose, right?
Absolutely. I mean, from the time I walked through their doors, I felt like I was being enveloped. You know, and every step of the way there was a person to help me with, whether it was results or the next procedure, or to walk me through or deal with even the spiritual aspect of going through this. They treated the whole human for me, not just my body.
Yeah. And how are you today?
I'm great. I'm healthy. I'm well. I'm living. I'm really great.
And what about you? You see your friend here doing quite well, and knowing that you played a good part in giving her the support she needed.
Again, I was one of many, but the inspiration is beyond measure. Beyond measure. It made everything that I was going through in my life very small compared to what she did, and it gave me actually a new outlook on life. The cruise, meeting the medical professionals from Breastlink, understanding what they did. And when I met, I'll never forget meeting with Dr. Curcio with Kapri at one point. She accepted me as part of the package. So when I had questions, she readily answered them and took the time, and that made me feel more comfortable. But the cruise and Breastlink, and I just can't say enough about it. It's really an amazing group.
And that's nice that Breastlink, the people over there, took the time to speak to you
Exactly.
as well, to let you know what's
Exactly.
going on, and at times probably gave you a heads up of this is how Kapri is probably going to feel during this time and what she may or may not need.
And
Yeah.
allowing me in those sessions to take notes, because when you're experiencing something like this, you're getting a lot of information. And so when we walked out of the appointment, we were able to say to each other, okay, this is what I heard, what did you hear?
Absolutely.
And then have the notes there. And they were so welcoming in that respect.
Well, I'm glad you're doing well.
Thank you.
And I'm glad you have such a good support group and a great friend, and obviously other friends and family as well.
And a great doctor.
Yeah. Breastlink, their location here, Laguna Hills, not far away, over by the mall over there, 949-770-0797. And as you can see, they really take care of you. Yes, they're going to do their best to take care of the medical needs, but the whole person is what's sometimes even more important, right?
Absolutely.
All right. Good to meet you,
Thank
and
you.
you as well.
Thank you, Ken.
We'll be right back.